Distinguished Stop TB board members and invitees, ladies and gentlemen. To begin with, please allow me to congratulate the Stop TB Partnership for hosting its 35th board meeting. I'm confident that this board meeting will be fruitful to accelerate our efforts to end TB. Ladies and gentlemen, allow me to quote Anne Frank's wise words during the hardship that she endured. She said, "Where there is hope, there is life." Hope fills us with fresh courage and makes us strong again. With the COVID-19 pandemic setting back our progress to end TB by 2030, hope is needed more than ever. Our fight against TB is further challenged by the large gap of funding dedicated for TB. In 2020, Stop TB Partnerships and Treatment Action Group showed that funding for TB research reached only $95 million, less than half of the $2 billion goal set at the 2018 United Nations High-Level Meeting on TB. As we are now recovering from the COVID-19 pandemic, there is no better time than today to realize, commit, and take actions to increase funding for TB. If we have any chance to beat this disease, we need to stand together and ensure equitable access to funding globally. We need to equip countries to be able to fast-track tuberculosis research and eventually provide us with the much-needed state-of-the-art technology to produce novel tuberculosis vaccination, therapeutics, and diagnostic. As team guests, the COVID-19 pandemic hit Indonesia hard, and now we are trying to get back on track in our efforts to end TB. If I may share one of the most important lessons from our country in source of TB funding, is that the collective efforts of governments, non-profit organizations, donors, and most importantly, the people themselves, are key in closing the gap of funding. The investments generated to end TB requires diverse sources of public and private funding. Today, I will share with you about the potential public financial instruments and resources. First, social health insurance is a nationwide mechanism that can finance TB services as means to achieve universal health coverage. Social health insurance will promote equity in the health system and avoid catastrophic costs for households affected by tuberculosis. In Indonesia, our social health insurance programs covers TB diagnosis and screening, whereas TB treatment and prevention therapeutics are funded through our national budget. Second, national and subnational government budgets can be prioritized to finance TB services. Indonesia have issued high political commitment through the Presidential Decree on Tuberculosis Prevention and Control. Hence, shortly after the budget for TB program shrunk significantly in 2020 due to reshifting for pandemic allocations, the amount already bounced back in 2021 to the pre-pandemic level. Third, governments can access loans from development banks through mechanisms such as loan buy-downs, blended loan grant financing, and converting debt into grants. And lastly, as Indonesia assumes the G20 presidency, our government endorses stronger international collaboration to support TB program recovery. International financing through multilateral platforms are substantial in supporting low and middle income countries. Dearest colleagues, to end my message, I have hope that many lives will be saved by our collective efforts to end TB. And I wish this hope fills you too, with fresh courage to get our fight back on track to end TB by 2030. Thank you.